Good day to all of you watching this video. I'm Herng, and together with my friend Puah Jing and Teh Jie Yan. We are from SKEE3263 Electronic System, Section 7. Here you can see our poster. We are here to present Minda Hadir, an electronic solution designed for student health and mental well-being. This project is directly aligned to SDG 3, Good Health and Well-being, which aims to promote mental health and well-being for all students. The core issue we identified is students are physically hardier at school, but their Minda is struggling. Current manual monitoring by teacher is hard and inefficient because they are overburdened with administrative tasks and cannot subjectively assess emotional state of every student. While Ministry of Education has also intensified the Minda Sehat program, screening are still rarely conducted. This means that a student could fall into crisis between these screening windows without anyone noticing. This brings us to our solution, Minda Hadir. The name itself means the mind is present. It is a smart kiosk that replaces traditional manual attendance taking. Instead of a teacher simply checking a name on a list, which is hard and inefficient way to spot mental distress, our kiosk uses affective computing. Every morning, when the students came to the faculty, to the school, they enter their metric number. The kiosk itself performs a quick white check. It doesn't just ask, "Are you here?" It silently asks, "How are you doing?" So this transforms the school gate into daily frontline for mental health support. So Minda Hadir is designed to be seamless and non-intrusive. We know students are in a rush, so the kiosk uses a high-resolution camera and integrated sensors to capture micro-expression in less than 2 seconds. So it looks for signs like fatigue, loneliness, and high stress, which is the key indicators. By automating this, we remove the social stigma of having to walk into the counselor office to seek for help. This system identifies those who are struggling in silence and alerts the school health team automatically. In short, Minda Hadir is about early intervention. We want to catch the 12.9% student who can't sleep due to worry before they become the part of 9.5% who attempt suicide. We are making a school safer and more supportive environment through technology. So now, let's take a look of what we've done for this. So this is what we've done. It's a simple and nice looking design. It's a kiosk that's suitable to put in front of the school, in front of a classroom. So students can take their attendance while having the white check during the morning time when they step into the school. As solution developer, my role was to ensure this innovation is not just a concept, but a feasible electronic system that aligns with our national safety mandates. I will now pass the floor to our survey coordinator, who will share the insight we gathered from the ground that shaped this design. Thank you.
Next, I will explain our survey results, followed by how our proposed solution contributes to SDG 3 and the operational details of the system, and finally its impact on sustainability pillars. So based on our survey findings, we identified several key weaknesses in the current student health and mental well-being reporting system. So firstly, regarding the effectiveness of current reporting systems, 62% of students only speak up when they experience serious issues, while 21% of them stated that the current approach is reactive rather than preventive. This clearly shows that the existing system relies heavily on students self-reporting problems, which often happens too late. And only 70% of the students feel comfortable with the current manual reporting system, which indicates a low trust and accessibility of students on behalf of this kind of issues. Secondly, when we look at the counselor intervention and peer support, 56% of the respondents believe that the system should focus more on the early detection rather than handling issues only after the incidents occur, which currently represent 37% of respondents. Additionally, 7% of the students are unsure whether the intervention is even necessary, highlighting a lack of awareness and structured monitoring. These survey results strongly suggest that the current system is insufficient, delayed, and lack of preventive mechanisms, which reinforce the needs of an automated and proactive solution. So regarding the contribution of our system to the SDG 3, which is the good health and well-being, our proposed solution with the Hadir directly supports the Sustainable Development Goal 3, which aims to enjoy healthy lives and promote well-being for all. Firstly, the system provides free daily screenings for all students, ensuring equal access to mental and physical health monitoring without additional cost. This removes common barriers such as financial limitations, stigma, and also limited access to the healthcare services. Secondly, by placing the monitoring system within the school environment, healthcare is brought to where students already are. This encourages early participation and normalizes mental health screening as a part of daily routines. Additionally, the system enables real-time monitoring and acts as an early warning system for emerging mental health trends. This allows schools and authorities to respond proactively rather than reactively, improving the overall student well-being and also reduce the risk of severe mental health outcome occurs among the students. So now, I will briefly explain how our system operates. So the Minda Hadia kiosk performs non-instructive daily screenings as students enter the school. It operates automatically without disrupting the normal attendance routines. The kiosk uses a thermal camera and detects a normal body temperature and a high-resolution camera combined with AI-based emotion recognition models such as convolutional neural networks to analyze the facial expression, which link to the emotional distress of the students. So, all the data is securely stored in a cloud-based system. If there is a sign of distress or abnormal patterns are detected, the system will automatically flag the student for early intervention. This intervention may involve a school counselor or a hero friend peer support program, ensuring timely and appropriate support. Importantly, the system integrates with the existing school attendance recording system, which minimizes additional workload for the teachers and the administrators of the school. So, what are the impacts of our system on the sustainability pillars? So, there are three sustainability pillars, which are the economic, social, and environmental. From the economic perspective, early detection reduces long-term healthcare loss by preventing serious mental health crises. It also helps reduce absenteeism and improves students' long-term academic and career outcomes. So however, from the social perspective, the system promotes a safer and more inclusive school environment. By normalizing mental health screening, it reduces stigma and encourages students to seek help earlier, fostering a culture of care and well-being in the school. So, if from an environmental perspective, the digital and cloud-based nature of the system significantly reduces paper usage. The kiosk is designed to be energy efficient, as centralized digital storage minimizes the physical waste and resources consumption. So in conclusion, I would say that our survey results highlight that the clear gaps in the current system, and the Minda Hadia, which is our solution, offers a sustainable, data-driven, and preventive approach that supports SDG 3 and also improves the school operations and contributes positively to all these three sustainability pillars.
So I will be explaining the flow chart and the block diagram. So first of all, let's look at the flow chart, the block diagram first. There are inputs, process, and output. So the first one is the inputs. We have 4 inputs, which is the thermal camera, all right, to measure the body temperatures readings. The second one is the RGB camera that will scan through the students' facial images for emotion analysis later. Then the third one is the microphone, all right, it will record the voice tone and stress analysis. And then the fourth one is the NFC or QR recorder reader that will scan the student's ID for verification. All right. Then the process, we have the hardware layer, AI processing layer, system management layer, and the feedback loop. Then the outputs, we have the immediate user feedback to school, and then the staff and system output, data reporting to a certain official, and then the health outcome of the students. Next, let's look at our flow chart. All right. So when the students arrive at the school entrance, they will need to enter their metric numbers, all right, or they have their metric cards that will scan through the system, all right, at the machine, and then the smart registration kiosk will activate it. Okay, then there are 3 inputs that will work. The first one is the microphone. The second one is the thermal cameras. And the third one is the high resolution camera, all right, or RGB camera. All right. After they scan and get the data from the students, the data is then processed and analyzed by AI analysis engines. Then the system will then secure a cloud login, all right? And then the system will ask a question if the students, all right, is detected a fever. If yes, which means that the thermal sensor measure the student's temperature is higher than the preset value. So the system will alert with the health officer, and then directly the student's attendance is recorded. Then the data is uploaded to cloud, and then students can leave the school entrance and enter school to studies. All right, and then the second scenario is that the system will ask if the student have a consistent sign of fatigue or fever. All right, if yes, then it will flag school counselor, and give and the peer support is activated. All right. If no, the students student attendance is recorded, then data is uploaded again to the cloud, and then student can leave school entrance, all right, and ends. All right. If the third scenario is that when the students is not a fever detected and no consistent sign of fatigue distress, and then the same process, all right, is recorded again, all right. And then for our main reference, all right, which is the Institute for Public Health, and at 2022, all right, with the National Health and Mobility Survey, Adolescents Health Survey. So that's all of my sharing.
And that's all from us. Thank you.